Good morning. Today we're gonna talk about cephalosporins. Do you know any cephalosporin in the first generation? We have IV presentation and PO presentation, cefazolin and cephalexin. And do you know why we use that for? There you go, gram-positive cocci and gram-negative rods. The mnemonic to remember the gram-negative rods that they cover is PEC, as Proteus, E. coli, and Klebsiella. Now, moving forward to the second generation, do you know any example of them? We have IV and PO, cefuroxime and cefaclor. Do you know why do we use that for? Very good. We use it for gram-positive cocci as well and gram-negative rods. The gram-positive cocci is less broad than the first generation, and the gram-negative rods is a little broader. We have the mnemonic HENPEC for H. flu, Enterobacter, Neisseria, and again Proteus, E. coli, and Klebsiella. Very important. Among the second generation of cephalosporin, we also have the cephamycins, and they are important because they are the only cephalosporins that cover anaerobes. In their name, they normally have a T among them: cefoxitin, cefotetan, cefmetazole. It's not very particular since there are several cephalosporins with T among their names, but just something to consider. They are not very used in the United States because we have better medications to cover anaerobes, but something to consider. And now, in regards of the third generation of cephalosporins, do you know any examples? Obviously, the IV widely used ceftriaxone, but do you know any PO presentation? There you go, cefdinir. Why do we use this for the third generation cephalosporins? Perfect for gram-positive cocci, gram-negative rods, and very important, gram-negative cocci. Do you know any gram-negative cocci? Perfect. We have Neisseria, but we also have Moraxella and Veillonella. That one is mainly a pathology for ventilator-associated pneumonias. Perfect. There is a couple of third-generation cephalosporins that in addition cover Pseudomonas. Do you know any of them? There you go. Cephalosporin and ceftazidime. Ceftazidime to consider is one cephalosporin that could have cross-reactivity with aztreonam, but we will talk about in a future video about that. Now, moving to the fourth generation of cephalosporins, we have cefepime. There is no PO presentation, and what do we use this for? Gram-positive cocci, gram-negative rods, and among the gram-negative rods, the space organism. Do you know what are the space organisms? It's an acronym and is for Serratia, Pseudomonas, Acinetobacter, Citrobacter, and Enterobacter. Very nasty gram-negative rods that cause trouble. And now, moving to the last but not least, cephalosporin is the fifth generation, and we have ceftaroline. What do we use this for? What do we use ceftaroline for? Perfect. Some gram-positive cocci, some gram-negative rods, but particular MRSA. So the fifth generation of cephalosporins are the only ones who cover MRSA, and that's why we use it for very bad purulent cellulitis. And if you have a patient with an intra-abdominal infection, let's say a UTI and a pneumonia, you want to cover MRSA, ceftaroline could be a good option. Thank you very much.